Let's come in. Let's come in today with all the energy. Go ahead and start putting in where you're from, which country you're speaking from. Start typing it in because today we're going to talk about a formula. Yes, I can call it a formula that I consider to be the one I followed. The formula that many of my students will follow to succeed in interceptive orthodontics. So let's go. Come in here. Just put it right there. The doctor is saying she's speaking from Spain. If you're from another country, go ahead and put it in the chat. If you're just joining now, you already know that we organized a big event. It was 3 days of classes with lots of live sessions for preparation. If you took part, if you're here, it means that you most likely attended those classes. Who here is present?
Let me know in the chat.
If you're a Dr. Intercept, put it in the chat. If you're a Dr. Intercept, 1, 2, 3, 4, 5, 6, 7. Put it in the chat if you're a Dr. Intercept and your group. Because we're going to start this live session with full energy. If you're here on Instagram, you're probably looking for something interesting. It's sabotaging us. It's cutting us off because we've been posting a lot these days. So do me a favor. The prof has prepared a super special live session. If you're here, give this video a like on YouTube. And if you're here on Instagram, send this live to a friend so Instagram stops cutting us off here. Because our posts are reaching fewer people since we're trying to reach more. And Instagram is limiting us. So help us out. Tap that little airplane icon, send it to 5 friends, or just tag your friend here with that and their name, because this content might reach a friend of yours and could help them out, okay? Right, I shared, if you shared this live today. It's also the last day to sign up for the diploma program, right? Today. Or is it not? So, those of you who will be with me will continue with me inside the Intercept Diploma. So you can go there, sign up at yosoeintercept.com because the team, if you need anything, will help you out. These are the last spots because our group is already almost full. So if you want to grab this last spot in Intercept, go there and sign up, okay? Today we're going to talk about the formula for success. And sometimes people say there is no formula for success, but actually there is, okay? It exists because I went through all those moments. I went through it, I walked that path, and I can tell you it exists. I'm going to put a filter on here because the teacher is tired. Oh my God, this is too much. This one's better. This one's prettier. This one's prettier. Let's see. This one's better. You don't deserve to see the next part with a tired face like this. So let's see. I went to the New Orleans Congress. I was already alone, and at the Congress, every year I go to the American Orthodontics Congress, and I had never been to New Orleans before, and I was already there at the Congress, and I did this live from over there. Sharing this formula with you, I remember feeling very emotional because I arrived, I rented an apartment, I rented an Airbnb over there in the United States. Who here has been to New Orleans? Has anyone here ever been to New Orleans? It's a really big city, a city that's different from the rest of the United States. It's full of parties and all that. And so I rented an apartment there, and I was a little scared because people there party a lot and everything. So at night I felt a bit afraid in the area where I was staying. I remember doing this live and feeling really emotional inside the apartment, which was really beautiful because there's something very connected to success about stepping out of your comfort zone. And now I have a very clear question for you. Do you think you're stepping out of your comfort zone? Yes or no? Write it there for me. Right there if today you need to get out of your comfort zone, or if you already think that you're doing your best and stepping out of your comfort zone. Greetings, Dr. Cohn, greetings. So the thing is, I always say this, there is no success in the comfort zone. The comfort zone is very pleasant. It's very cozy. It's very nice. It's really lovely to be in a comfort zone. But if you're always doing the same thing and you notice that your routine is always the same, thank you. It means you're not stepping out of your comfort zone. And the greatest successes in a person's life are outside the comfort zone. Think about how many times you felt afraid, challenged, and in the end achieved great success after that fear, after going through that fear. Because it's stepping out of the comfort zone that allows us to surpass our limits. So take a moment now to reflect on your life. Do you think you're in your comfort zone, or do you think that sometimes you need to put in a bit of effort to get out of that comfort zone? Have you ever stepped out of your comfort zone? Or do you need to make an effort to leave your comfort zone? Do this self-reflection and let me know here, because it's important for us to be aware of this, okay? There is no success in the comfort zone. If you agree with me, write in the comments, there is no success in the comfort zone. And when we learn about this, we start to think, okay, so I want to get out of my comfort zone. I want to learn more. I want to master interceptive orthodontics. What path should I follow? And first, we're going to go through 5 points, all right? These are 5 important points for us to succeed in interceptive orthodontics. Because if I ask here, who is it that wants to succeed in interceptive orthodontics? Wants to have a ton of patients in interceptive orthodontics? The other day, I showed you a case from one of my students who, in just 1 month after starting interceptive orthodontics, reached over $800,000 in profit. So the question I ask is, do you want to succeed in interceptive orthodontics? Write it there for me. I want it if you do, because now we're moving on to the first point. The first point is, without a doubt, mastering diagnosis. Do you remember FOCA? Isn't that right? What was FOCA? Write it in the comments. FOCA, if you know what FOCA is. The FOCA diagnosis is facial analysis. Occlusal, cephalometric, and anamnesis. So this is our focus, our facial, occlusal, cephalometric analysis, and anamnesis. And from the moment I do my facial analysis, I can do a better assessment of what my patient needs. If my patient is a Class I patient, if my patient is a Class II patient, or if my patient is a Class III patient. For example, here I have a patient who is a Class II patient. So I see this patient as a Class II pattern. I know that this patient doesn't have a mandibular problem. I know that this convexity of the profile is due to maxillary protrusion. I know that point A is further forward in relation to the nasion. I know that this base of the nose is short. I know that this point B is in the same direction as the nasion, unlike this other patient. This other patient already has a different facial pattern, a different profile condition. So you see that the treatments are completely different for patient 1 and patient 2. This is a Class II patient due to mandibular deficiency. This is a Class II patient due to maxillary protrusion. So they are completely different diagnoses, and here I have an analysis that comes before the entire facial analysis. Nowadays, there are other tools I can use. For example, I can do a facial scan of my patient. Who here already knows about facial scanning? Type in the chat for me. I already know. Where is it? Where is it? Where is it? I can make a detailed map of this entire place. I can do. Yes, okay. I can certainly do that for you. Thank you very much for your patience and understanding. Look here. Can you hear me? Yes. Can you hear the teacher? Type, I can hear if you can hear me. Type in the chat for me if you can hear me. Yes or no? Type it in the chat. Yes, okay. So, loves, this type of facial analysis, like digital facial analysis, for example, is the most up-to-date thing we have in the world. An analysis that is a facial volume analysis to identify the patient's facial pattern. Using a facial scanner. I don't know if you already know, but this is a material from Korea that has already been and is already being used by most orthodontists in Korea, and now it's arriving in Latin America. In fact, this is the second device that exists in Brazil, and it's with me here at UNICPO. It's actually an incredible tool for any clinic, for any orthodontist. The brand is Morphis, which manufactures this facial scanner. And with it, you can get all the measurements of the patient's profile, the volume, and you can detect what changes we are able to make in a patient with a Class 2 pattern or a patient with a Class 3 pattern. So we're able to have this kind of contribution. Okay, Professor, so I know that I have to master diagnosis. So I need to master FOCA diagnosis. Facial, occlusal, cephalometric analysis, and anamnesis. I showed you a bit about 3D facial diagnosis, about how facial analysis is growing around the world. Before, many people would define the diagnosis and treatment plan through cephalometry. Who here has ever heard a professor say something like this? Oh, if the SNB is 75, we put in a propulsor. But if the SNB is 80, then the mandible is well positioned and there's no need to use a propulsor. And all of that, my dears, is a lie. Because if I only look at the patient's cephalometry, I won't get good results. So, what do we do nowadays with technology? I can combine facial analysis with cephalometry. That's what technology brings us. Why? Because cephalometry by itself is just a tool. Thank you. In our hands. It won't define the diagnosis. So I can superimpose the lateral cephalometric X-ray with the patient's facial analysis. That's when I can get good results in the diagnosis. All right? So, okay, Professor, I understand. So, I need to master diagnosis. I need to do a good facial analysis. And the thing is, if you don't do a good facial analysis, you'll be the doctor from the past who diagnoses patients only through cephalometry. There are even people who don't even know cephalometry. That's why inside the Intercept Diploma course, I tell the students, you have to use cephalometry as a tool, as a friend, but to truly master interceptive orthodontics, it's impossible to do so without cephalometry. It's your duty to know cephalometry. How do you expect to treat a child patient if you don't know absolutely everything about the points, the planes, genital cephalometry, cephalometric superimposition? Interpretation is a must. And that's why in Module 1 of Intercept, we already cover diagnosis. How do you do a facial analysis? How do you do an occlusal analysis? How do you do a cephalometric analysis? Do digital cephalometry. Oh, doctor, but I don't have any software. A digital cephalometry software costs at least $500. Some are $2,000. And in the Intercept diploma, in the first module, you learn how to use digital cephalometry software completely free. Oh, doctor, but I'm 60 years old. Will I be able to do it? My students who are 60, 70 years old, they all manage to do it because it's very simple. So you see that with just the first module, the diploma already pays for itself. That's how it is. Very well. So, number 1, master the diagnosis. Cool. Number 2, what would be the key to success? What is the key to success? Number 2, master the technical part. Master the technical part. How so, Professor? There are doctors who want to master interceptive orthodontics, but they don't know how to fit a band. They don't know what it means to have a well-fitted band with retention without being on the occlusal surface. They think they can just put on a band, and that band will end up squished on the patient's occlusal surface. Or they're putting the bands on the wrong tooth, because most of the time we don't use the first permanent molar as anchorage. And then suddenly the appliance starts to come off. Oh, doctor, I activate the hiatus up to a certain point, and then it comes off. I start having problems with the retainer coming out of the mouth. I have a patient that I treat from Panama because the orthodontist didn't know how to place a high-res, and the mother comes here to get treated by me. So, look, why is that? Because there was a technical failure. Because sometimes they let the lab itself choose the band, and that's not allowed. Who has to do the evaluation? Is it you? Or if you work with a super high-tech lab where you don't need to adapt bands, you just send the scan to the lab, you still have to know if the appliance is wrong. You have to know if a band is loose. Because the success of the treatment depends on this technical ability. Who here has ever had problems with an appliance that didn't fit? Who here has ever had problems with an appliance that came out of the patient's mouth in the middle of treatment? With a patient who got tired of the treatment because the appliance wasn't right. That's really bad. That makes you feel really bad. So that's why we need to study. And that's why inside the Diplomate 7 in Module 4, I go into detail about how to adapt a band, how to transfer and take an impression of a band, how to solder a tube, how we activate them, because it's necessary to know the technical part. If you don't know the technical part, you're going to start having problems, you're going to start having issues in your treatment, and you won't even notice the problem. That's when people will say, oh, the Hyrax is bad. It's not bad. It's your knowledge that's not enough. Oh, doctor, but how can you say that to me? Because it's true. And it's totally fine not to know everything. Is it really okay? You don't need to know everything. There were many things I didn't know that I know today. I started out just like you. I began without knowing anything. Maybe you're doing much better than I was back then. I had zero knowledge. I started from scratch. And how did I do it? I went out to look. I went out to learn. I went to study. I went to learn because I knew that I didn't know. Now, as long as you keep pretending that there's a wonderful world like Alice in Wonderland, where you act like you know everything and don't accept your own mistakes, nothing is going to change. So either you make a decision, no, that's enough, no more, I don't want to keep failing in my treatments. I don't want my patients to keep suffering because of my lack of skill, because of my lack of knowledge. I don't want to keep losing patients or referring patients because I know that I don't know. That's the best thing. When you say, I know that I don't know. It's so much better. It's truly liberating because then you completely free yourself. Your shoulders are wonderfully relaxed. You absolutely don't need to wear a mask pretending you know everything. It's totally fine not to know. And there's absolutely nothing more beautiful in the entire world than openly admitting that we genuinely don't know something. It's like, I don't know, I just honestly don't know. Breathe. I don't know. Repeat after me. Right there. I don't know. Did something happen? No, nothing happened. So now you're ready to open yourself up to something new. I'm opening myself up to something new because now I know that I don't know, okay? So it's very important for us, number one, to master the diagnosis. Number two, to know a lot about the technical side, about band adaptation, about drag impression, about appliance activations, about bends in interceptive orthodontics, about deactivations, about how I need to adapt the patient, how I'm going to install a lip bumper, how I'm going to install a Schwartz, how I'm going to install a Millens, all of that, the technical part. And now we move on to part number three. For our part number three, I also want to show you a scientific article, okay? We're going to talk about part number three, and I also want us to study together using an article. Who here is willing to study an article with me today? Yes. Who's in? Type, I'm in if you're up for it. So, what is an important point in interceptive orthodontics? An important point is that we need to know how to combine treatments. I have to know how to combine treatments. What do you mean, professor? There are treatments that we do in the transverse, vertical, and sagittal directions. So sometimes I can't just look at my patient in only one dimension. I have to understand that my patient has malocclusions in all dimensions, and that many times I have to treat them in stages, but sometimes I can treat different types of malocclusion with just one appliance. So I need to check how my patient is doing. Who wants to see a case? Type in the chat if you want to see a case. A case that explains what I just told you. Type it in. I want to see a case. If you want to see a case. Let's go. Let's do it. Who wants to see a patient? What's the idea? I do, so we can see them. This patient is interesting because they're a common type of patient you see in your practice. So look here. Is it possible to see? Take a look here. Here I already have a patient with a convex profile. I see. The chin neckline is short. The upper lip is quite forward compared to the lower lip, and I have a very convex profile. And this patient, when it comes to the public lip, I see a very expressive lateral cephalometric X-ray in terms of the inclination of the upper and lower incisors. And here comes the cephalometry. I have the cephalometry indicating, according to WITS, a skeletal class 2. Look, 5.2 of skeletal class 2. And look at the completely digital cephalometry. My intercept students no longer do manual cephalometry. If you're still doing manual cephalometry, stop because you're wasting your time. Nowadays, cephalometry is digital. So the child comes in with this malocclusion. Notice that I have a mild transverse maxillary atresia. I have this anterior region that is edge to edge, actually. And there's a special characteristic. This patient has a finger-sucking habit. He used to suck his thumb. So at that moment, I didn't say anything to the parents. He already had this disappointment with the finger, which was inside his mouth. And then we placed an appliance, which is a trap. For me, are you with me? All good? Are you understanding? Type in there, I'm with you, prof, if you're with me. So here we have the fixed lingual trap in position. I have the 4 little parts of my trap. I had to bend the extensions of the trap a bit because they were a little too long for the patient. They were already hitting the floor of the mouth. And look what happened after the trap. Watch. Open your shoulders. After I put in the trap, look what happened. It got significantly worse. Just look at precisely how much worse it truly got. It got a great deal worse. Who among you here actually noticed that it got noticeably worse? And indeed, guys, it got much worse. The bite became considerably deeper. And why did this happen? Imagine for a moment that the pacifier actually ended up being something that effectively reduced the visible appearance of the overbite in this particular patient. So the patient was brachyfacial. The patient already had a tendency toward a deep bite, but this tendency wasn't showing because the finger was in the patient's mouth. So, what do we have to do in this case? Now we're going to start looking at the patient in 3 dimensions. I already know there's a deep overbite, so I have to make a decision. What's the decision? Either I wait until the growth spurt, or at this moment I talk to the parents to find out if it's important for this child to make the decision to start Class 2 treatment now. And one of the advantages of Class 2 treatment is that I can combine Class 2 treatment with the treatment for the deep overbite. So, look, the child was like this, and that's when the treatment started with my all-time favorite appliance. Today I taught a class on interceptive orthobionics to some wonderful students here in Brazil, and I showed them this very case. Which appliance is this? Drop it in the comments if anyone knows which appliance this is. Who here is my student already knows? Who here is my intercept student and knows? Which appliance is it? Put it in the comments for me if you know which appliance it is. And one of mine here. Very good. This is an Anderson activator, And look, one of my students here knows, my students know, the Anderson activator is the appliance we use a lot for correcting Class 2 in the university. Let me find another image so you can see the activator. So this is the activator. Dr. Udias, my student, intercept. Udias is tired of hearing me talk about the activator all the time. The Anderson activator is a device used for treating Class 2 skeletal pattern in patients with skeletal Class 2. So these should be patients with mandibular retrognathισm. These children should have an active growth pattern. And it works extremely well in our child patients. Let me find another photo here so you all can see. So, it's a device that has some features different from other appliances. I'm going to show you. So, this is an androgen activator. We don't check by the patient's age. We always consider the bone age. So, I always have to take a hand x-ray and risk to be able to see what stage of ossification the epiphysis is at with the diaphysis. If I have a post-growth spurt stage, I can still use an androgen activator. But I have to know that I might get fewer positive effects than if I use it during the growth spurt. So, this androgen activator is a very interesting device because it has some components. For example, the expansion screw, the posterior part of the tracks that help me correct deep bite malocclusion. If you also look, there's this coating on the incisal part that prevents the child from having too much flaring of the lower incisors. So I have the whole labial arch. I have the retention clasps, which can be C-clasps or Adams clasps. I also have the posterior acrylic part. And I have this coverage in the C-section and the expansion screw. That's what makes the androgen activator such an amazing appliance. In my opinion, my favorite appliance, the removable functional appliance out of all orthopedic appliances, is my favorite. And there, in our Class 2 model, I explain step by step how to make a construction bite. I explain how we achieve it. Thank you. How to trim the acrylic part, activate the appliance, and all the other features. So, we see what we are able to do. It's wonderful. Doctors, Lily asked, what about patients with vertical growth? In patients with vertical growth, we use the activator, but with another appliance combined. Look at the before and after. Check that out. It doesn't even look like the same patient. I'm always amazed to see the effects of this appliance. It impresses me. I love seeing what we are able to achieve through our work. Look at the before and after. Look at the before and after. Who here can see the effects? Type in the chat if you can see the effects. Let me know in the chat if you can see it. Look at that, before and after. That's what we can do with our knowledge. With our knowledge. So, number 1, when we talked about the formula for success, it was mastering diagnosis. Number 2, mastering the technical part. Number 3, combining treatments. Number 4, implementation. What does that mean, Professor? It means knowing how to install the appliances. For example, I've seen many cases from doctors. You advanced point B, doctor. No, point B was advanced quite a bit. His width, which was 5.69 or something like that, went down to 2 millimeters. In other words, it improved a lot. What does it mean to implement? It means knowing how to install and control the appliances. Let's think about the Anderson activator itself. The Anderson activator, for example, is a simple appliance. But I have to know how to activate it. I have to know how to control it. I have to know how to make a constructive bite. I have to know the activation schedule. I have to know how to adjust this appliance. What else? For example, a simple face mask. It's a face mask. Okay, it's a mask. But I have to know how to manage this patient. I have to know how to activate the mask's elastics. I have to know how many hours the mask should be worn. Or for example, an AEB, a conjugated AEB. I have to know how to fabricate it. How much distance do I have from the buccal arch to the incisors? How much force am I going to use? What is the inclination of the buccal arms? Or then, another appliance here. Let's look at an appliance here that you all know. This one here. A 4 by 12 appliance. A 4 by 12 appliance. I did a live session here for you all. Module 4 of the Intercept Diploma is only about the 4 by 12 appliance. And now I recorded an advanced course on the 4 by 12 appliance to teach how to work with omegas. So, you see, the 4 by 12 appliance is simple. It's simple. But you have to know how to use it, because if not, you can have a lot of side effects. Apical resorptions, root resorptions. So it's simple, but you have to know the arch wire sequence. You have to know how far you can go with each arch wire. You have to know the differentiated segmentation of the brackets. You have to look at clinical cases to gain experience before doing it for the first time. So our point number 4 for success is to implement. Study beforehand, but implement. Place appliances. Gain experience. Place 1, 2, 3, 4, 5, 10, 15, 50, 100 appliances. Do it many times to gain experience, to know how to do it. This is one of the keys to success, doing it many times. I'll tell you all, once in my first wire bending class, I left the class crying because I felt like I wasn't going to have the skill. I was telling that to Edgar, to my husband. We recorded the module together about. I don't know if you all know, but Edgar, my husband, isn't just anybody. Edgar works in audiovisuals and marketing, and I was telling him, Edgar, you don't know, I was bending the wires and he said, if I were a dentist, I think I'd be good at bending wires. And I said, no, I think you would be good at it, because he's very meticulous. Whenever he's going to do something, it takes him hours, because he's always so detail-oriented and everything. And I said, I wasn't good at bending wires. I really wasn't good. I don't know if anyone here also felt that way when they started bending wires. Does anyone here feel like they're not good at bending wires? And honestly, I already have a shoebox where I practiced bending wires until my hands got rough. Because I left the wire bending class crying, just crying. Orthodontics is not for me. I don't know what I'm doing. Why am I trying to force something that I'm not good at? And I was bad, one of the worst in the group. It's not that I was just a little bad. And then I left there and I thought to myself that I had to make a decision. Today I was going to give up. I was going to do something else. I was going to do radiology, restorative dentistry, something else. Or I was going to face the problem head on and practice until the wire bending got tired of me, until I could do it with my eyes closed. And folks, I don't know if you've ever watched those documentaries about people who lose their sight and then their other senses become much sharper. They start doing things they never did before, and I'd put that idea in my head that I didn't have the talent, but I had the effort, and one thing I'm good at is being determined. Guys, there are sparks in my tail when I am determined to do something. So, what I lacked in talent, I made up for with determination. And that's how it was. Every night I would sit down, start bending wires, and if I messed up, I'd put them in the shoebox. Or if they turned out well, I'd put them in the shoebox too. Until that shoebox started filling up with more and more wires. And I kept practicing bends for interceptive, bends for corrective. And there came a point where I could honestly do it with my eyes closed. So, I want to leave this message for you. Sometimes, if you think orthodontics isn't for you, has anyone here ever thought that? Like, oh, orthodontics isn't for me. Take it easy if you like it, because I liked it. I really liked it. If you like it, you just need the right method, the right technique, and a mentor. That's what you need. Because after that, if you get moving and start putting in the effort, there's nothing that can hold you back. Nothing can hold you back. Also, keep this in mind. Leave this live today with that in your head too. And well, our fifth and final point. Who's been with me since the beginning? 1. Master the diagnosis. 2. Master the technical part. 3. Combine the treatment protocols. 4. Implement. And now we get to number 5, knowing how to apply it in your business. I want to tell you something. If today you think you're earning too little, it's because you're not seizing the opportunities that already exist in your practice. It's because you don't know how to take advantage of the opportunities. So, my loves, the fifth part is knowing how to sell the treatments. Knowing how to make money with the treatments. Because obviously, interceptive orthodontics is a calling. For me, it's a calling. Seeing the kids after their treatments truly makes me happy. If you're hearing this live, you must feel the same way as the teacher does. Seeing a child's eyes light up, seeing them breathe better, seeing them speak better, seeing them act in a freer, happier way. Isn't that happiness or what? That truly makes my soul smile. I love it. I'm truly passionate about the results of interceptive orthodontics. Does anyone else feel the same way? Let me know in the comments. If you're passionate about it too, write it down. I'm passionate. I'm passionate. Yes, fall in love with the results, the changes in growth, The outcomes we see in the face, in the soft tissue profile. Let me know, yes, if you're also passionate about the results of interceptive treatment. And the thing is, we need to learn that what makes us happy, what God has given us as a purpose, should also generate income for us. Because there are a lot of people who think money is bad, but money is actually very good. Money is good because when you have money, you can do good things. So it depends on the person. There are people who have money and do bad things. But there are people who have money and create jobs. They help families. They help their own family. Every time a patient asks you for a discount and you give them a discount that wasn't planned, you're taking away a Saturday afternoon you could have spent enjoying with your family to give to that patient. And maybe you've already felt this feeling of giving discounts, of often not feeling valued in your practice. Feeling like the patient doesn't appreciate what you're doing. Feeling like the patient doesn't want to pay. Feeling like you're earning too little for what you do. And sometimes you really are earning too little for what you do. So there's nothing worse than getting to the end of the day, being tired, being exhausted, and knowing that this day brought you little money. Because after paying all the bills, you'll have just a little left over. Who here has gone through that? Me, I've gone through that. And then, what do we have to do to improve our lives? There's only one way out. We have to train ourselves more so we can understand more about a treatment. So we can do a treatment better. And so we can charge more for that treatment. But where does it all start? With knowledge. All right? With knowledge. So, my loves, the last module of the Intercept diploma is about sales strategy. Because I know that I want my students to make a lot of money. My students have to make a ton of money. My students deserve to make a ton of money. Because I know they've spent days studying the third diploma. I know they're going to spend days studying. They're going to put in their effort. And our effort deserves to be valued. Get one thing into your head. You are not a charity institution. You are not. You should be recognized for the work you do. You should be recognized. You deserve to earn well for the work you're doing. The thing is, things aren't automatic. You need to train yourself first. You need to get in touch with new knowledge first. Because if not, you're going to keep following this. Pain of feeling bad about earning little, of feeling like there's no time, of feeling like you're being pulled in so many directions, being a mom, often your kids, your family, your husband, and work, and at the same time having to work, and at the same time not having time for anything, not having time for yourself, often not even having time to go to a salon, to take care of yourself, to get a massage. You don't even know what that is, because you're tired. So, enough. Enough. No more. No more. And that's where an opportunity exists. The opportunity to be part of the diploma program. Do you understand? The opportunity to live a different life. The opportunity to step out of your comfort zone and really start getting results through the Interset Diploma program. Look, this is my student, Dr. Daniela Merici from Argentina. Dr. Daniela Merici, I talk to her all the time. This was the day she graduated from the Intercept Diploma program. Afterwards, she sends me photos. Look, the day I bought my car in 2021, thanks to what I learned from Intercept. The day she got home from the office, the pool was finished. Her dream was to have a pool. With Intercept, she made that dream come true. The day she remodeled her office, she sent me photos. The day she took her daughter to Disney, which was her dream, thanks to the knowledge she gained. Who here wants to go to Disney? Who here wants to take their kids to Disney? Look, what an inspiration. This other doctor, Dr. Cecilia from Peru, 35 new patients and 40 more, a 40% increase in revenue. Her dream was to come to Brazil, and she did. Look, she was in Brazil with me. 40% more in revenue. So, if you are a general dentist, the Intercept Diploma is for you. If you are a specialty student, the Intercept Diploma is for you. And if you are a specialist, it's for you too. Because you'll be able to learn in a way that's very different from someone who's already gone through a specialty, from someone who's updating themselves. Look at my students' cases. How wonderful. Jessica's case. What a beautiful case. Who here can see the difference between the before and after? These are the kinds of cases you'll be able to handle after the Intercept program. Look at my students' cases. Dysfunctions. Anterior crossbite treatment. Fan appliance. Facial mask. Case after case after case from my Intercept Diploma students. This is the Intercept method. I'm going to talk to you, my loves, for the last time about the Intercept Diploma. Open your heart to learn about the methodology. Because we're down to the last spots, the final hours. Take a look at the methodology and see why this methodology can change your life, just like it has already changed the lives of so many doctors. More than 4,000 doctors have already been transformed by this methodology. Is there any of my students out there? Well, the Intercept Diploma is online, so you can see your patients. If you have a gap between patients, you can study. You can do it on Sundays at home. You can do it in the early morning while taking care of your baby. So, it's online. The Intercept Diploma. We release new modules every week. So in 4 months, you can finish your diploma. So now you can finish a 1-year diploma in just 4 months. Here I am. I can't wait for it to be November 7th. My wonderful student. Oh, teacher, right now I would like to do the Intercept, but I just don't have the time. I understand that you don't have time, but there will come a moment when you will have time. So, sometimes you say you don't have time because you're making excuses, because honestly, you do have an hour in your week. You waste even more time on your phone. You waste even more time doing things that aren't productive for you. You waste even more time doing any silly thing. And you could be investing that 1 hour you have each week in your growth and your education. If you don't have time, you can simply set aside 1 hour a week. Because you have a whole year, 12 months, to finish the diploma. It's clear that the teacher will do everything possible and put in a ton of energy so you can dedicate more time each week and finish in 4 months. But if you don't have time, you can set aside just 1 hour a week. Who here is going to tell me they don't have 1 hour a week? It's a lie that you don't have 1 hour in your week. It's a lie. For an international diploma that's going to bear fruit in your career, you have this honor. Sometimes you say yes to a bunch of toxic things in your life that won't bring you any results, but you say no to your education. The time has come to say no. No, now I'm going to say yes to my education. The time has come to say yes. So, who doesn't have time? It's a lie that you don't have time. You, in reality, just say you don't have time. Hello. From the moment you start seeing results, just like Dr. Gabby, who earned over $800 in a month, you'll find the time. If I told you, look, I'll give you $500 a month just to study 2 hours a week, who here would take that offer? Would you take this offer? I'll give you $500 a month to study 2 hours a week. So what happens is that you do have the time. You have that time, but you don't want to use it because you haven't seen the results yet. But from the moment you start seeing results, you'll start making that time. All right? So, we make time for what is a priority in our lives. Stop saying there's no time. That's just not true. The Intercept diploma comes with a certificate endorsed by UNICPO, which is the largest university in Brazil for training Latin Americans. The Intercept diploma is based on 2 pillars in its methodology. The science, which consists of 12 modules divided into the basic cycle, clinical treatment cycle 1, and clinical treatment cycle 2. Within these modules, we have modules on diagnosis, documentation, aspects of normality, transversal treatment, band adaptation, 4x2 technique, treatment with extractions in children, treatment of pattern 2, treatment of pattern 3, open bite treatment, space maintainers for impactions, laboratory modules, and sales strategies. Everything that exists in the field of interceptive orthodontics is here. Everything. And we have the practical killer. The question is your day-to-day in dentistry more theoretical or more practical? You'll probably say, oh, Professor, it's more practical. That's why there's practice included in every module. In each of the modules, you will find practical exercises. Practice activating appliances, practice with separators, practice with bands, practice with patients installing a face mask, practice on how to make appliances with a dental technician, practice on how to bend a lip bumper, practice on how to make a Ryrax, practice on how to activate a Ryrax, practice on how to install a Ryrax, all of that. At the end of each module, there is a practical section. Look at all the hands-on exercises we have in each module. Practice on how to install a 4x2, practice on model analysis. All of that includes a practical part, and all the students will receive some gifts. After you join Intercept, it's not just classes on the platform. We have our classes on Bibo. Amazing classes, classes full of energy. Sometimes you joined here in the Preventive Orthodoxy Marathon and started thinking, wow, Professor, you really made me want to study. I know, it's the power, it's the strength of a community. So all the students receive this gift. The other gift that all students receive is personalized mentoring on 3 clinical cases. So there are 3 cases that students can submit, and in this way, they get the personalized experience of sending in their cases and receiving a treatment plan from their instructors. It's the personalization of your difficult case. You who are here, maybe you have a difficult case, so you can send us this case so we can plan it together. Orthodontics is often a very lonely field. You don't have anyone to ask. Being part of a community that supports you is essential. That's only possible because I have a group of professors. I couldn't do it alone, but all these doctors are PhDs in orthodontics and they help me. They are also my personal friends and they help me answer every question from my students and assist with these clinical cases, planning the clinical cases. I want to be intercept. Type it for me in the chat if you saw all that and said, I want to be intercept. I want to be part of this community. I want to be part. I want to have my access to the platform. I want to be a parent. I want to be an intercept student. I want to have my questions answered for a year. I want to have this knowledge. I want to be part of the live classes. Why are you feeling motivated? And why? That is an incredible feeling. It's the realization of a dream for many doctors who are here. And what the professor can tell you is, what are you missing to make the decision? What do you need? Maybe you, who are here, are asking, Professor, what is the investment for the diploma? Let's go, the investment. So, if you had to pay for the 12 modules on the platform, the cost would be $3,000. For the 5 live classes, $500. Personalized planning for 3 cases, $150. Individual question tutoring, $400. The dentist portal, which I haven't even mentioned yet. Everyone who completes the Intercept diploma will gain international visibility on a dentist portal. Incalculable. Access to the group's case library, incalculable. Library of articles and supplementary materials, incalculable. Altogether, it would come to $4,050. But we managed to get a super discount. So the price of the Intercept diploma won't be $4,050. It will be $797. $797, my loves, for a whole year of access to the platform, for all the live classes, for all the classes from the 12 modules on the platform. We can ask unlimited questions for a year. We can submit 3 clinical cases for personalized mentoring, and you'll get an internationally recognized certificate from UNICPI, all without paying anything extra for that. $797. It's amazing, very cheap, very accessible for a year-long diploma program. But I understand that maybe you haven't planned financially to join Intercept at this moment, and that's why we're also here to help you. You don't need to pay the $797 right now. You can pay in installments. So, in this first month, when you use your credit card, you'll only be charged at your card's due date, and you can split it into 4 payments of $219 each. 4 payments of $219. In other words, you study, earn the money, and then pay for the diploma. That's very affordable. And there are a lot of people who are going to say, "Oh, doctor." But that's not affordable. $797 isn't cheap. It's not affordable. Who here thinks the Intercept diploma is affordable? Write it in the comments for me. It's affordable. Write it in the comments. It's affordable. But there's always someone who says something. "Oh no, it's too expensive. The Intercept diploma is very expensive. 1 year. Questions answered for a whole year. 12 modules on the platform." With all the knowledge of interceptive orthodontics and the updates the professor will add this coming year. All the supplementary readings. A whole experience of being part of a powerful community that will push you forward. And there's always someone who says, "Oh, that's too expensive." Now the question is, who are you? How are you going to want to charge properly for a treatment if you think a 1-year diploma costing $797 is expensive? What kind of professional are you if you choose a diploma or course just based on whether the price is affordable or not? Because if you see the diploma as expensive, it's not for you, since you're not able to see the potential income you can generate with this knowledge. That's an investment. What is an investment? When you put money into something that you know is going to multiply. That's an investment. An investment in a bank, when you put money into something and you know it's going to multiply. The thing is, all investments carry risk. Every investment in the world has some risk. If you have an investment in land, in real estate, or in a house, in a bank, you know, there's risk. The only investment where there is no risk, well, I shouldn't say the only one because there could be others, but the investment in the Intercept diploma has no risk. There's no risk because I trust that it will be a good course, because when you take a course, there's always the risk that the course might be bad and then you lose your money, or the risk that you might not like it and you lose your money. But with the Intercept diploma, there's no risk. Why? Number one, I have a lot of trust in the method. I trust that people get results. I trust and I know that if you apply the method to 3 patients, you'll quickly recover your investment. And there's no risk because I trust the method so much that I offer a 15-day guarantee. If from now, the moment you enroll, right now, you enroll right now, and tomorrow you wake up with a different opinion, you decide you don't want to keep going back and forth, you just send a message to my team and we refund your money immediately. Why? Because we don't want people with us who don't want to be with us. You get it? Because we want people by our side who want to grow, who want to prosper, who want to move forward. So, I give you a 15-day guarantee. All right? In other words, the risk is 0. Make the decision. The teacher will always be here on social media, creating content. Lots of videos here on Instagram, on YouTube. I'm not going to stop doing that. There are a lot of people who will keep consuming free content. and the teacher's free content is really good. The thing is, there will come a point where you won't grow anymore, because you'll just stay on the surface. It's like an iceberg. You have to see what's underneath. You have to study with doctors. You have to get to the root of the knowledge. Because staying here, just on the surface, with free content, will make you keep feeling stuck. And I don't want that for you. I don't want you to stay on the surface. Not for another year. I want you to take off next year, make decisions, change your life. But you need to take the first step. There's a part in the Bible that says when we put our foot forward, God lays down the ground. But God won't lay down the ground if you don't take that step. The time has come for you to take that step. The time has come for you to make the decision. You need to make the decision for good things to happen in your life. And I know what I'm doing. I wouldn't be here talking if it weren't for the more than 4,000 success stories we have. Go for it. Make your decision. And I guarantee you, your mindset will change. All right? Your life will change. If your dream is to remodel a practice, if your dream is to pursue a specialty, anything is possible through knowledge. Just like it has already happened with my students, okay? So, this is the end, my loves, of today's live. I am immensely happy and deeply grateful to everyone who participated, whether you're an Intercept member or not. If you took part, I am very happy. Thank you for being here with me. I am so grateful to you for your attention, for your participation. I am truly happy, and to the doctors who will also continue with me, I am honestly happy because I know that together we are going to achieve great things. Thank you so much to everyone who took part in this great movement. We don't have to wait. All of this was planned with a lot of love, with a lot of joy, by many people, by the entire Odontologia Sin Fronteras team, who are even now working hard so that we can change orthodontics worldwide, because now we are already talking about the world. I'm tired of going to places where I teach and seeing people who are still saying that we have to wait. This army of "we don't have to wait" was created with a lot of joy, with a lot of dedication. And if you took advantage of this knowledge, I want to thank you, because you are part of this movement. The time has come. With this live, I am concluding our marathon. For some, it's the end of a cycle. For some, it's the end of a cycle of lives. For others, it's a beginning of a new life, of new knowledge, of studies. Choose what you want for yourself, whether you want an ending or a beginning. So go there, enroll, and I'll be waiting for you here in my heart. Thank you for everything. Eternal gratitude. And we don't know when we'll have another Intercept group, but kiss. Thank you, my loves. There's no need to wait. There's no need to wait. A kiss.
Last course opportunities just released, and we are finalizing inscriptions for the next group of doctors joining the Intercept course. And I still haven't seen your name on the list. Doctor, this is your chance to master interceptive and preventive orthodontics without leaving your home. Learn with a proven methodology that has already transformed the careers of over 6,000 dentists in more than 40 countries. Click Learn More and join the Intercept course today.